again. So I review your medical history, everything looks updated. Now I'm going to check your periodontal measurements and continue your assessment.
Okay.
3, 2, 3, 4, 2, 3. You okay now? 3, 2, 3, 2, 1, 2, 2, 1, 2. All right, so I'm done with your exam for today. Compared to your last visit, everything's looking a lot better. Just some 3 to 4 millimeter pockets, some slight calculus, and some light inflammation here or there. But overall, everything's looking a lot better.
Really? Last time the hygienist told me that if I didn't brush or floss, I was going to lose my teeth. And she told me that I needed to come in every 4 months for my cleanings instead. And because she said my mouth was such a mess.
I see.
Honestly, it was embarrassing. She made me feel so ashamed, and the cleaning really hurt. Like, it had my mouth sore for 3 days.
I'm really sorry you had that experience with her.
And my daughter, she saw that hygienist too. She's 16 and she came home in tears after the cleaning, saying that it hurt so bad. And then I checked her chart though, and it said that she only had light plaque, so I don't really know what to believe.
Thank you for telling me that. I can't see why you would be so upset and confused.
So are you telling me what she was saying is the truth?
Well, what I can tell you is that patients deserve truthful, respectful, and evidence-based care. Based on what I'm seeing today, I do not see a condition that matches the level of fear you were describing. You do have some areas to work on with home care, but that is different from being told you're about to lose all your teeth.
That makes me feel so much better.
Yeah, I'm glad to hear that. My job is to help you understand your oral health, not scare you. I'd like to step out briefly and update the doctor about your concerns so we can handle it appropriately, okay? And then I'll come right back and answer any other questions that you may have.
Okay, thank you. Uh-huh.
Hi, doctor. Can I talk to you for a second?
Yep.
So I just saw our recall patient in OP2, and during today's visit, she shared concerns about her last appointment with another hygienist.
What happened?
So the patient said she was told her periodontal condition was so bad that she could lose all her teeth if she didn't improve immediately. She also said the information was delivered in a demeaning way and that the scaling was extremely painful. She reported soreness for 3 days afterward.
Does her condition today support that kind of statement?
No. Today I found mostly 3 to 4 millimeter readings, localized light calculus, and localized marginal gingival inflammation. Her condition does not appear severe at all.
Well, that is concerning.
I thought so too. She also said her daughter had a similar painful experience with the same hygienist, even though her daughter's chart reportedly showed light plaque.
Then this may be more than just a communication problem.
Exactly. From an ethical standpoint, I'm concerned about non-maleficence because there may have been physical and emotional harm. I'm also concerned about beneficence because patient education should help the patient, not shame them.
Agreed.
Veracity is another issue. If the condition was exaggerated, then the patient may not have received accurate information. That affects trust, autonomy, and our professional responsibility.
Yes. Patients need truthful information so that they can make informed decisions.
And from a standard standpoint, we're responsible for the competent care, accurate documentation, respectful documentation, and clinical judgment avoiding harm.
Do you think there could be legal concerns too?
Possibly, if the treatment was too aggressive, there could be negligence or a failure to meet the standard of care. If the disease severity was exaggerated, there could also be misrepresentation or unprofessional conduct.
Well, you handled this appropriately, bringing it up to me, the dentist. Go ahead and document your findings, and I will find you later.
Thank you, Dr. Zoidberg. I'm going to go back and answer the patient's questions. Okay. Hi. Okay. So, thank you so much for waiting. I did speak with the doctor, and I just wanted to let you know that your concerns are being taken seriously.
Okay, can I ask you something?
Of course.
Should I report this to the state board?
So you do have the right to file a complaint if you believe you were harmed or treated unprofessionally. Usually the first step is to let the dentist or practice owner review the concern and address it directly. But if you feel the issue is not handled appropriately, or if you believe there was a serious harm, you can contact the state board if you like.
So you're not saying I should just let it go?
No, not at all. Your concerns are valid. They should be reviewed and taken seriously.
So just between us gals, have other patients complained about her too?
So I want to stay focused on your experience and your care for today. It wouldn't be professional for me to discuss other patients or private staff matters. But what I can tell you is that I heard your concern, I documented my findings, and I reported it to the doctor.
Okay, I understand.
I also want to reassure you that based on today's exam, I do not see findings that suggest you are about to lose all your teeth. You do have some inflammation and areas to improve with brushing technique, but we can work on that together in a supportive way.
Okay, thank you. That's all I wanted, was just someone to explain it without making me feel bad.
Yeah, you absolutely deserve that. As a healthcare provider, we are expected to provide safe, respectful, honest, and patient-centered care.
I appreciate that.
Of course. I'm going to finish your visit notes and then I'll step out for just a moment, okay?
Hey, I heard you were asking for me?
Yes. Is it okay if we go speak privately for a moment?
Yes, ma'am.
So a patient shared concerns about her last visit. She said the scaling was very painful and the way that her periodontal condition was explained to her made her feel embarrassed and afraid.
Are you talking about who was on your schedule today? Yeah, I saw her last time. I remember. Well, some patients just don't like hearing the truth.
I understand that difficult conversations are sometimes necessary, but the way we communicate matters. Patients should be educated with honesty and respect, not fear or humiliation.
I was just trying to get her to take things seriously.
Yes, I understand the intention, but our responsibility is to provide accurate, evidence-based information and avoid causing harm. If a patient leaves feeling physically hurt, emotional distress, or misled, that becomes a professional concern.
So what happens now?
I reported the concern to the doctor so it can be reviewed appropriately. I thought it was important to speak with you directly as well because patient comfort, professional conduct, and trust are essential in our role.
I see.
Yes, we all represent the profession. That means practicing with no maleficence, beneficence, veracity, and respect for patient autonomy. Our patients deserve nothing less.
I understand.
Yeah, I appreciate you hearing me out. I just felt it was important to address it because our patients trust us and the way we treat them matters.
Yeah, I get that.
At the end of the day, we all want the same thing, for patients to get good care and feel respected.
Right. I'll keep that in mind.
Okay, thank you.
What happened to the real hygienists? What happened to keeping it real with our patients? Huh? Your mouth looks terrible. Go fix it. Come back in 3 months. What's so wrong with that? You said what? Something's wrong with my jacket? Oh. Go away.
Something's wrong with her. I do not get paid enough for this. Cut the camera. Cut the camera.
Women, am I right? Can't work with them, can't live without them.